we're struggling. The hospital says we're doing well, but we're not. They're not listening to us.
We deserve better pay, we deserve better ratios, and our community deserves better ratios.
We're both from ED and the ratios down there are just shocking. There's times where we're caring for upwards of 20 patients and it's not right anymore.
Nurses at a privately run hospital in Sydney are holding work stoppages today, demanding a 15% one-year increase and mandated patient ratios.
We don't have the ratios and it's unsafe and really, really awful for us to work under those conditions. We're going home and we're feeling so deflated for trying to do our best, and we can't do that because we don't have the support.
We operate as a public system in a private sector, and there's no reason why our patients shouldn't deserve the care that they would receive in a public sector.
Today we're fighting for mandated ratios, more nurses to look after our patients, the safety and wages that reflect our work and keep up with inflation.
We've got patients being left in wet beds. We've got patients that can't be fed because there's not enough hands to feed them. It is not acceptable.
We miss breaks, we stay late, we pick up overtime, jeopardising our own health to ensure our patients are as safe as possible in the frankly dangerous conditions we're faced with. We're morally injured, doing the best we can with the bare minimum that Healthscope's provided.
For negotiations in Healthscope, it has been incredibly difficult. We've been to 15 meetings of 3 hours length with them, and their response has been nothing short of appalling.
No good faith bargaining, no negotiation, just no. They put these signs up and these posters up all over our hospital and say, call us if you've got any questions. I have a question. Where's my annual leave?
We were told that we're not actually classified as shift workers because if we don't work a certain amount of Sundays a year, and because of that our annual leave is different to the public sectors, and that's really not fair.
I've been fighting for a new hospital for so long, and then we get a public-private hospital and they're not providing good public care.
Apparently Healthscope has a finite pot of money. They need to get a bigger pot.
We want our 15%.
We need nurse to patient ratios. We need babies to count as numbers. We need improvements to allowances such as on-call and night duty. It's not enough to pretend to value us by giving us the occasional sausage sizzle or sending out a staff survey that just gets ignored.
15% pay rise will actually help us to pay our mortgages, to pay for everything basically in Sydney, which everyone is struggling at the moment.
Healthscope won't acknowledge that with the cost of living, people are having to choose between having a fridge full of food for their families or petrol in the car to drive to work and do a shift.
At the moment, you're currently 2.4% behind the public sector and up to 16% behind the Healthscope nurses in Queensland. We're doing the same damn job. All in this together, we're all under the same rubbish EBA and all looking at the same offers. So we all need to stick together.
I would really like to see the New South Wales government make Healthscope accountable.
We have performance audit by the Independent Auditor General, and that needs your support. You need to get behind that. You need to share your stories. You need to make some submissions to it.
We're invaluable, and it's time we're treated that way, not only for our sake, but for the sake of our patients.
You guys deserve better, and we are here with you every step of the way.
We will continue to get out the front, and we will continue to cost them money, and we will continue to fight.